This is a public service announcement for the Province of Ontario.
Nursing is a self-regulating profession, meaning that the government recognizes its ability to protect the public and act accordingly. This is ideal because nurses are best suited to determine their own standards of practice, required level of education, and basic competencies that allow for an appropriate level of care.
What exactly is nursing? Nursing is a science and an art, and we cannot have one without the other. While it takes a sharp mind to master the science of nursing, there is also an art to caring for patients. The role of a nurse bridges both. The science of nursing is the knowledge and the technical aspects of the practice, while the art is the establishment of a caring relationship through which the nurse applies nursing knowledge, skills, and a judgment in a compassionate manner.
This year, we were exposed to many different learning opportunities. The concept of trauma-informed care was one. Trauma-informed care means treating the whole person and being sensitive to their past traumas when attempting to understand patient behaviors. For me, this meant understanding why patients may react in a negative way to our actions. They are coming to us at their most vulnerable moments, and it can be hard for them to be understanding and compliant. One time in lab, I had an experience where a standardized patient was overly critical and angry at what I believed was just a simple mistake. I did not understand her behavior. I assumed she was just a mean person. Later, she explained that the mistake I made had brought her back to a traumatic event when she was in the hospital, and a nurse made a similar mistake to mine, and it led to grave consequences.
Self-care was another concept that became apparent this year. Prior to nursing school, a lot of us didn't take the time to take care of ourselves. This is important because even though we aren't nurses yet, we carry many stresses and we need to dedicate time to activities that relax our minds and bodies. Some individuals choose service professions like nursing because they want to relieve the suffering of others after experiencing or witnessing traumatic events in their own lives. These nurses also discuss that following exposure to personal trauma, an individual's coping strategies may be ineffective.
Another example of newly gained insight is the importance of noticing, which is a concept that was introduced since the very first day of nursing school. As nursing students, we now understand the importance of being aware of our surroundings from the moment we enter a patient's space. Our noticing skills allow us to interpret hidden issues our patients may not be telling us. For example, noticing that the patient is wincing in pain while we palpate the abdomen during an abdominal assessment, rather than simply focusing on our skills.